He was born here in Fairfax Hospital, and he's a 5p minus. That means his fifth chromosome, the lower part, is slightly deleted, and due to that, he's severely mentally and physically challenged. So he's totally dependent on other people for his daily needs, for everything, spoon feed, everything. He's still in diapers.
He recognizes voices. So if he sees, like when I walk into the room and he kind of knows it's me, he's extremely affectionate. He'll crawl to people he's fond of. He'll put his hand up. He'll want to sit on their laps. So the first thing that we did was we put a chairlift on each and every stair in our house. So there's a lot more we would like to do, but we're not able to do because the seed money that the county gives us is not enough. We are getting old. We are not able to provide the kind of support he needs. But what we do get is we do get the state helping us provide round-the-clock nursing staff for Taku. And we really, really appreciate it. If we didn't get the kind of support we get from the state, the quality of care that he gets would be really poor. He would not be the happy, healthy person he is right now. He has a disability that's not going away. He's not getting any better, but yet every 6 months we have to do a whole lot of paperwork to renew it. And many times they actually turn us down. They're like, no, he doesn't need a nighttime nurse. Or they will come back with, you need to justify why he needs so much. We're on pins and needles before it gets approved because we're not 100% sure that it is going to get approved. It's a lot of stress on us.
One thing, the paperwork should be very simplified. As she mentioned, every 3 months, 6 months, we go through that trauma, it's such a thick paperwork, half the forms are filled by doctors justifying each and everything, So this should be for a more 1 year because person is not going to change, It is not that he has a disease or something which can be cured, Remove this insecurity that what will happen after 3 months, 6 months, if the disability is permanent, there's no need to ask and renew those things. Those kind of improvements can be done.
Connor has 6 disabilities, but he's the most amazing human being. He lights up a room when he comes into it. He's like a gentle giant. He loves to hug people and be involved. He is completely nonverbal. He does require assistance every day with everything from bathing to toileting to dressing to food preparation and all of that. But he is truly an angel, and he's taught me just to love and forgive and be in the moment. So the day before he turned 22, he had public school, he had occupational therapy, physical therapy, and all of the resources of the school, and the bus coming, and then the bus stopped coming, and it was literally like just a volume of nothing, a vacuum. Being a public educator, I knew that they would stop at 22. I didn't know that the whole world would stop, that the county had so little, and it would be left completely to me and to Connor's dad and stepmom to figure everything out. There was nothing. The resources in our county were very far and few between. Waiting lists that were 7 years long. I reached out to other parents. They were in the same boat. Everybody was like scrambling to try to find help or babysitters, and I didn't want Connor to just sit at home because he deserves the right as a human being to be an active participant and to have friends and be in the community. So it doesn't have to be like this in Virginia. I have a friend who I grew up with in Pennsylvania who has a child similar to Connor with disabilities, who is also 26. When she and I talk on the phone, she says that everything is just laid out for her and she doesn't have to really navigate anything. Like, they have figured out what her daughter needs and they provide the resources for it. She never has felt alone. And I just feel like we could emulate that in some way, like the amount of paperwork that is required in the state of Virginia, and then finding the places, and then just everything, finding the help and finding the places, and it all falls on us. And I don't understand how we can be so close in the states but so different.
I decided to live on my own 2023, 24. Because my mom couldn't really take care of me anymore. I'm the one that has to take care of myself, even though I have a caregiver. I'm the one that has to make the appointments for the doctors, the one that makes the appointments for transportations, even food. I have to go buy food so that they can cook it. Even my medicine, I have to tell them exactly what time I need it. Or else they just don't do it. So, because the government placed a new policy on one of my medicine, my doctor would not prescribe my medicine that I needed, which I've been taking for over 20 years. So for 2 months, I've not had any of my medicine. So I had to call my insurance to get me another doctor that can do the prescribing and not tell me to go see a psychiatrist and neurologist. Doctors. I have to fill out paperwork for them for like Metro Access, for renewal, for my wheelchair. If anything's broken and I need it fixed, the doctors need to know. Some doctors do treat you as a patient that knows what they're talking about. Others, they think that because you're disabled, you don't know how to take care of yourself or talk for yourself. So most of the time, they would be like, where's your family members? Or do you have any relatives? So sometimes it feels like they are not trained to handle people with disability, which is also frustrating sometimes and confusing too, because they spent years studying and practicing, but yet they don't know how to do it in the field.
We are more than the piece of equipment we come with. Sometimes people have come up to me and say, I see you everywhere. Being part of the community is important to me because I like to go out and run errands and go and do things every day that other people do. Involving people with disabilities in any design process, whether it be a sidewalk or how the metro is designed, or even if there's going to be a set of stairs somewhere, is important, because then everybody can see, the designers can see what is wrong at the moment so that it can be designed correctly the first time, instead of having to go back and redesign it. In all my years going through, I was asked to go talk to the forestry about parks and whatnot. And there was an actual builder in the audience. And he was like, well, darn, if I had known what I know, what you now tell me, I wouldn't have to go back and redesign all my apartments to make it work for everybody now. The biggest things that I would say was to the legislators and policymakers is include people with disabilities in those choices, because we deserve to live a life like everyone else, and without that, you're not going to notice the things that we know that are wrong. We're not trying to downplay your leadership roles. We're just trying to enhance them, because if we can help you do that in the first place, then you won't have to go back and redesign the laws and the policies that are being created.